guys, my name is Nick McClary. I'm a second-year student in the Doctor of Physical Therapy program at the University of Tennessee Health Science Center, and I'm also a personal trainer. Today I'm going to talk to you about core exercises. Now, whenever I'm prescribing core exercises for my patients with low back pain, or whenever I'm prescribing core exercises for my clients who just want a stronger core, I like to always make sure that I get the core strong from every direction. So when I look at the core, I like to look at it in a functional context. Now, the core's primary role is to keep the spine safe and to keep it nice and neutral. So our extremities can pick things up off the ground, they can move around, but our core resists the movement to keep our spine straight. So the exercises that we'll do today are a little bit different. Now, crunches and sit-ups and everything that's traditional is good. This is just another way to look at core exercises. So the first exercise will be anti-extension. So the force will be trying to pull us into extension. We're going to have to use our abdominals to pull down nice and tight to keep our spine straight. The second exercise will be anti-rotation. So we'll have a force that's trying to pull us into rotation. We're going to use our obliques to keep our core nice and tight, nice and neutral, and resist that force. And the last exercise will be anti-lateral flexion. So we'll have a force that's trying to pull us into lateral flexion of the spine, and we'll have to use our core muscles to keep us nice and tight and neutral there. So before we start any core exercises, I do like to also point out that whenever we do core exercises and work our core, we want to make sure that we have a nice neutral spine. Now, a lot of people will overextend. They'll kind of arch their back too much, stick their butt out a little bit when they're doing core exercises, because the hip flexors also attach on the front of the pelvis and the spine and pull into extension. They also help the abdominals to perform their movements. But what we want to do, since we're trying to work the abdominals and trying to keep a good spine, we're going to really squeeze our glutes together, pull our rib cage down, and make sure that our core is stacked nice and on top of each other and nice and strong. Okay? So don't let that back arch out, but keep it squeezed nice and in a neutral spine. Our first exercise, anti-extension, called a physio ball rollout. So we're going to roll out with the physio ball, trying to keep a straight line between our knees and our elbows. So we'll start out, we'll squeeze the glutes, pull the rib cage down to initiate. We'll roll out, trying to create a straight line. We'll hold for 5 seconds and come back up. Again, squeeze in a neutral spine, roll out, and come back up. Alright, so we'll do about 10 reps, hold for 5 seconds each. Remember, hold a neutral spine the whole time. The other exercise we can do, if you don't have a physio ball, it's called a worm walk or a caterpillar walk. What you do is come down on all fours. You'll come out into an extended push-up position, holding a good neutral spine, and then you can walk back up. Then you can also walk back down, and then come back up. That way it's not quite as challenging as a physio ball rollout, but it's a good way to get something maybe a little bit tougher than a plank, as long as the arms are reached out nice and far in front of you. The next exercise is anti-rotation. It's called a Pallof press. You can use a band tied to a rack or a machine, or you can use a cable stack to select a weight with a cable stack. You use a single handle. You can grab the single handle with both hands, or if you're using a band like I have here, do the same thing, grab it with both hands, take one big step out, nice and wide. You're going to pull over to straight in front of you. Alright? And then you're going to push out. Okay? And you'll hold for about 5 to 10 seconds, then come back, then out again. So what the band is trying to do is pull you to rotate your spine towards the band. But what we're going to do is hold ourselves nice and tight and not let it rotate us. So again, we're going to hold for 5 to 10 seconds, come back in, go back out. So we'll do 10 reps, hold it for 5 to 10 seconds for each rep. Our last exercise that we're going to do is anti-lateral flexion. Now, if you don't have a dumbbell or a barbell, or even you use a heavy backpack loaded in with books, just to hold, kind of an offset hold, where you're going to keep your spine straight, you could also do a side bridge. So for this, you'll come down, one elbow, stack your feet, and then you're going to keep a straight line from your chest to your toes, the interval for about 20 to 30 seconds. Then, of course, go ahead and switch sides. So I hope this gives you another way to look at performing core movements in a way that we're resisting movement instead of performing movement. Keep our spine nice and safe.